Welcome to the podcast of the Consortium for History of Science, Technology, and Medicine.
Thank you all for agreeing to participate in a panel on federal regulations, the Progressive Era, and beyond. I am excited to be talking with the three of you, and I was wondering if each of you could introduce yourself. I am Gwen Kay. I am a professor at the State University of New York at Oswego, and my research interests are varied, but I started with looking at federal regulations, especially in the early years of the 20th century, culminating in the 1938 Food, Drug, and Cosmetic Act. And I've asked each of you here because of your areas of specialty, and I was wondering if you could tell us who you are, and we will start with Arthur.
Hi, I'm Arthur Daemmrich. I'm a professor of practice at Arizona State University and director of the ASU Consortium for Science, Policy, and Outcomes. My own research has studied both regulation and health systems comparatively and internationally. And CISPA, that I'm director of, is a bit of a policy think tank in DC that tries to bring social science perspective into the implementation of science and technology policy.
Thank you. Todd?
Hi, thank you for having me join this conversation. My name is Todd Olszewski. I'm an associate professor of health sciences at Providence College. My research started in the history of heart disease, and since then has moved more broadly into the history of biomedical sciences and health policy, and really examining the history of translational research. How is it that biomedical research translated into medical practice?
And Lauren.
Hi, everyone. I'm Lauren Thompson. I'm an assistant professor of history and interdisciplinary studies at Kennesaw State University in Atlanta. And I'm also a faculty research fellow at the Georgia State University College of Law, Center for Law, Health, and Society. And my research is primarily at the intersection of law, medicine, and women's health. And so I'm particularly interested in early 20th century progressive and also 1920s and 1930s, sort of getting into the New Deal era. I'm interested in birth control policy, the medical politics surrounding the birth control movement, eugenics, and how all of that intersected with the progressive emphasis on maternal child health.
Thank you. So I'm going to ask a bunch of questions for each of you, and we'll start with the progressive era and move forward. But I recognize, and I asked you to be part of this because your expertise is varied over the 20th century. And so we might start in the progressive era, but move to much more present day conversations. In the United States, the progressive era reformers are widely recognized as one of the first somewhat organized groups to push for reform in many spheres. For us, that activism leads to the 1906 Food and Drug Act and then the creation of the FDA. Subsequent eras see different regulations and different agencies are formed. How, or I guess do you, think that the legacy of progressive era has impacted federal regulations up to the present day? Or can we really play that game of 6 degrees of separation from progressive reformers to the people that you are most concerned with? And I guess, Lauren, I'll start with you as the earliest person in the sense of time here.
So for me, I think that's actually a question where there's actually less connection, because I was thinking broadly about maternal child health in the progressive era and how that played out with government policy. And really, the only time that we see it put into practice is there's two major places I think that we can talk about. One of which is the establishment of the Children's Bureau in 1912, which was formed out of the U.S. Department of Labor, and that's where it sat. And then we get the passage of the Shepard-Towner Maternity and Infancy Act, but that doesn't come along until 1921. And the Shepard-Towner Act was really sort of the first time that we had a federal focus on the health of mothers and children. And, there was sort of a comprehensive, it was sort of a proto kind of insurance, set of legislation that we don't really see repeated until much, much later in the 20th century. And so for me, I actually think that there's a big gap there that makes it hard to connect that progressive era focus on maternal child health with contemporary emphasis on maternal child health, because there's not a lot of overlap there. And I think there's so many decades intervening where we don't get to see any kind of meaningful continuity there. The Shepard-Towner Act was not renewed after 1928 or 1929, and then you don't get any government intervention really into healthcare around maternal child health at all until much, much later again in the 20th century. And so for me, I think there's more than 6 degrees of separation.
So if I jump in, so I agree with everything just said, but also there are some major continuities, and I would argue one of them they two relate to each other is around, our method of regulating. And so we think of food and drug regulation as sort of guaranteeing the safety and then more recently efficacy of drugs. But of course, the actual regulatory tool the FDA has is one of controlling what the label can say. And so it's very much that labeling, which dates back to the 1906 Act, and kind of what information can be made available to the physician and then to the consumer. And so control over the wording of the label becomes the battleground, and that actually remains in many ways true to the day. And then the second point to make in this is the tensions around medical authority. So the professional authority of physicians, pharmacists, and then, clinical chemists, and then FDA regulators. So who's really the one to make the determination of safety or of the exact wording? And those tensions around medical authority continue to play out. And in fact, I would in some ways argue are very central to the MAHA movement.
And I would jump in to add that I also see several through lines from progressive reformers to the present. I think Arthur's point about labeling and truthful labeling really touches at the idea of transparency instincts that the progressive era push for truthful labels finds echoes in today's warning labels, clinicaltrials.gov, adverse event reporting systems, this idea that sort of informed consumers are safer consumers. And I think I would also add the role of the expert bureaucracy, sort of scientific administration in expert-led agencies, whether they be the FDA or later the NIH and its efforts to contribute to the biomedical research enterprise. And I suppose last would be the notion of public-minded activism, thinking about patient and consumer advocacy in later decades, whether it be AIDS activists, cancer groups, shaping regulatory priorities and trial designs.
And Gwen, to your question around sort of legacies, some of them were also nearer term in the sense that the 1906 Act, in my mind, is really a shift from what had previously, the role of government seen in interstate commerce, in financial regulation, in some oscillating sense of, do we have a national bank? Do we not have a national bank? Americans have little ability to agree on that, in fact, up to the present. But suddenly there's health and safety as a concern, and labeling of products, branding. That's a new form of regulation. And I think, that's where the term regulation is written in blood comes about, where you have, in the wake of high profile tragedies, you get proposals for regulation, and it lines up to significant technology change in what some people call the second industrial revolution post 1900. So even, the FAA, so the Federal Aviation Act of 1958, puts in place a lot of forms of regulation in terms of how it's tested, how products should be tested, who gains oversight, that look a lot like what was done with FDA.
This makes me want to push a little bit more. You should never let a good crisis go to waste. It's not clear who actually said this originally, but certainly in every act that I have studied, there's always that one, there's lots of movement, there's lots of pushing for regulation, and then there's a very visible public tragedy that leads to all sorts of regulation. I'm not saying this is the best way to go, but it's very effective, and it galvanizes conversation, it galvanizes people. Are there specific crises that stand out to you in your research that's been used to create policy or regulation then or now?
That's a really, really good question. So at Providence, I've taught a seminar on historical and contemporary drug regulation. And I think one of the recurring themes of that class is this very point, that crisis drives reform, and it has for the last 110 years. You can really move through each decade of the 20th century and even the first decades of the 21st century and point to public crisis after public crisis that spurred the development of new regulations, whether it be the elixir sulfanilamide disaster in the late 1930s, leading to more robust pre-market safety demonstrations. You have the thalidomide crisis in the early 60s, leading to the Kefauver-Harris amendments, requiring greater efficacy data on part of manufacturers. In the 1980s, with the rise of the HIV AIDS crisis, you have patient activism really reframing drug regulation as a matter of access, as a matter of ethics, and you have the NIH and other government agencies sort of introducing new roles for community input in the regulatory review process. And I suppose more recently, with the COVID pandemic, you have emergency use authorization for the COVID vaccines, kind of serving as a first stress test for this particular regulatory option.
I find it very interesting that we can read a lot of this, especially like at the beginning of the progressive era, through the lens of gender and women's history, because so much of the activism surrounding the push for clean water, clean milk, improved our maternal child health programming was coming from women progressives who were active in their local clubs. And then obviously, even with the Shepherd-Towner Act, for example, the biggest push for the passage of that legislation was coming out of the Consumers Bureau. So there's always been this, in American history, I think we can really very safely say that for the 19th and 20th centuries, like any regulation was wrought by a crisis, and then usually lots of women who rallied together to try to get the government to address it. And there's, in the progressive era, there's really this messaging that women are attempting to make the government resemble the safety of home. And I always think that is so interesting. Todd, you had mentioned the thalidomide crisis, and I always think it's very interesting that Frances Oldham Kelsey, who refused to essentially approve the Williams Merrill application, the drug company who had trying to bring Kevidon thalidomide into the United States, and she was then held up as like this heroine in the early 60s. The one woman who had stopped the entrance of this drug that was causing awful birth defects in other countries, and it quote unquote doesn't touch the United States, even though that wasn't true, because the drug had definitely been distributed to physicians who had just kind of handed them out to their patients without much record keeping or anything. And so they were sort of scrambling after the fact to figure out what American babies actually had been born with birth defects because of thalidomide. But I think it's so interesting to think about how she kind of, that is one continuity I think we can say, is that here's another woman and she's held up as like the mom who stopped thalidomide from coming in, because she herself had 3 children, or 2 children. I think it was 2 children. So anyway, that is an interesting continuity, that we can read progressive era legislation around this stuff as being framed through a lens of women and gender and women's activism.
So to add kind of a complexifying point, if I may, I mean, Kelsey, I fully agree, and I've done research and was also, very impressed by what she did at FDA, both during, what became the thalidomide crisis, but then also her career afterwards, to really help create new clinical testing guidelines, and then also investigate and help enforce that, clinical investigators are fully ethical and carrying out clinical trials appropriately. It's interesting. I teach a course called From Airlines to AI, Regulating New Technology. And one of the case studies in the course is the disputes in the 1970s over what was called a drug lag. And so there you had Milton Friedman and this kind of effort at a deregulatory school from the Chicago School economists, who then begin arguing for the people saved by introducing these new regulations. We have others who are harmed because of the delay in getting new drugs to market. And so, there is this question around, so for each crisis, for certain high scale crises, we get new regulation, but there's more attention since the 70s to the kind of ancillary or second order costs of new regulation. And so I'm puzzled to think, there are also moments when either economic crises or the visibility of people harmed by delay of new treatments or of new technology can become a form of crisis, and that's then used to foster deregulation. And so I think it's actually a puzzle for historians going forward to what extent we understand crises as causal versus like a more complex notion, because there's lots of medical crises as well that don't lead to new regulation. So, why do certain ones and then others not?
As Lauren, you were talking about reminding us about the gendered piece, I was also reflecting, and then what you were just talking about with your course, Arthur, thinking how we have two different kinds of citizen advocates for health in the 80s with very different outcomes. We have people advocating for AIDS research, but only for very specific community. And so we are very aware of the three communities that are not part of a lot of this activism. And we also have breast cancer advocates who are tending to be white women of resources and in certain locations. And so they have different paths to power and voices. And some of what they're advocating for has changed the landscape, and some of what they thought was reality wasn't. Like, are there actually clusters, or is it lots of people of the same age at the same time being diagnosed with the same kind of problem? So our historian's lens can help us think about these issues. Are there other examples where you think our thinking about the past and thinking about different circles of people who might be advocating, or regulators themselves who might have some of these questions, can we offer them information? Can we use our knowledge of the past to help them inform the present, which will maybe transform our future?
I'll start first and see how this goes. As I think about the history of drug regulation and sort of going back to one of Arthur's earlier points, that safety and efficacy really sit at the core of federal drug regulation, and thinking about how in some cases we have regulation and reform that comes as a result of some public health crisis. It seems as if there is a need for balancing speed with trust. That as we live in an era where the regulatory agencies and the government agencies that are tasked with introducing and implementing reform and regulation, in an era where there is sort of greater public distrust of authority, whether it be sort of governmental or scientific, that public confidence is really going to hinge on transparency and consistent communication. So I think if regulators now and in the near future are able to find new ways to balance speed with trust, we may be able to better navigate future crises.
There was a time when, FDA did an awful lot more communicating about how it actually works and what it does. And so we have also over time, developed a lot of different regulatory agencies, at times with overlapping mandates. And so that's, of course, a challenge. But also, the complexity of the science that the agencies carry out can often get lost. And so I would say it's a piece of the work of the federal government to actually explain to American citizens what it does beyond just trust us, right? So it's also a bit of visible demonstration of its work.
I think they've done a better job at certain points of, than they have in others. I think one of the reasons that we're seeing the current crisis, for example, over vaccines and vaccine mandates is in part, I mean, I think many Americans saw the COVID vaccine, the emergence of the COVID vaccine as, a medical miracle. The mRNA technology that came to fruition in a vaccine that was like rolled out very, very, very quickly and has great efficacy. I mean, I think many Americans recognize that for what it was, but obviously in very large swaths of the country, that was immediately taken as like the government's trying to poison us. There's something wrong with this. The push to turn to alternative medicines in order to treat COVID is certainly, like horse dewormer, for example, is certainly an indicator of the fact that we have a divide in this country over how we view the FDA and its role. And I think some of that is actually just a product of its like short history in the grand scheme of things, even in the grand scheme of American history. It just hasn't been around that long. And I'm thinking about, a lot about the 60s and the thalidomide crisis and the Kefauver-Harris amendments that came in the wake of that. And I feel like we went from a period where Americans highly trusted the FDA to by within maybe 2, 3, 4 decades, not trusting the FDA. And then I think that was accelerated, obviously, in the wake of 2020. And we're, I think, reaping the consequences of that. Just the other day, Florida announced that it would roll back its vaccine mandates for attending school. And although that is questionable legally, we shall see if that really does come to fruition. The fact that the state surgeon general announced it, on television, that was what the plan was, I think is an indicator of where we are and just how deep the fault lines run in terms of what Americans think about health and the government and what is the government's responsibility to keep Americans healthy. I think obviously many people say the government does have a responsibility, and the other half says clearly they're saying we don't want you interfering in our private affairs. And so I think that maybe that's another continuity there too. I think that's always been a tension since 1906. You've seen that repeated over and over again, where, for example, and I keep going back to this, the Shepard-Towner Act, which I realize wasn't coming out of the FDA, but that was, even at the time was framed as a Bolshevik plot, and the women advocating for it were called communists. And so there's this sense that somehow the government attempting to regulate any kind of health and healthcare is somehow related to communism and therefore un-American. And so I'm not sure what we do with that. As historians, we can explain that. But I think that there's a monumental challenge then to somehow disconnect those threads that Americans seem to sort of implicitly understand, even if they know nothing about 20th century health regulation.
So one thing I observed in doing comparative research was when I compared the US and Germany, for example, with pharmaceutical regulation, it was striking that at least up until the early 2000s, the medical profession had a parallel structure in Germany, quite hierarchical, but of being able to kind of test and speak to the safety and efficacy of drugs. And so you had the government authority, but you also had the medical profession, and you had a much stronger pharmacist profession. In the US, we have highly concentrated our regulation of pharmaceuticals, our control over them in the FDA, and on this border, this boundary of, is it approved for market or not? So it's either in testing or it's on market. And, I commented earlier that maybe agencies could and should do more to communicate to the public what they do. But of course, the FDA has very successfully communicated that a safe drug is one that's had 2 independent, large-scale, randomized phase 3 clinical trials. And so by putting everything on one method, then when you don't do that because you say, well, look, this vaccine looks really safe and we've tested on a whole bunch of people and it's a crisis, then at some level you're getting hoisted on your own petard. And so some of what's happening is a little along those lines right now. And there's this real kind of complicated and interesting development around what the administration's calling gold standard science, which is an effort to go back to 1930s and 40s, kind of how philosophers and Robert King Merton in sociology understood science to work.
And I think the challenge is we are a group of historians who are thinking about public policy, and so we know what the before looked like in ways that the people who live with us are well aware because we talk to them all the time. But a lot of other people, including many of our students, might not be. And policy people aren't. And I'm making a pitch, obviously, for a return of historians at many federal agencies because they did help, and they can help sort of promulgate the Children's Bureau is no more, but what happened to those efforts and how do we still do things to protect children or other groups of people who we should be concerned about, and we would put regulations in place to protect them. Obviously, we can't bend this time-space continuum, but if you could go back and give your historical actors any advice, what might you tell them? Did they make mistakes? Would you want to prevent future mistakes? And if you know how to do this, please don't tell me because I'm going to be happy in my ignorance here.
I'll take a stab at that, just because I'm a historian and part of eugenics. You cannot decouple public health efforts in the early 20th century from the eugenics movement. So much of it was driven by eugenic understandings and eugenics is this messy, wide-ranging movement in the early 20th century in which it could mean many things. And we're talking, pre-Nazi eugenics. I think people tend to look at it through the hardening that took place, by the 1940s in Germany about what eugenics ultimately meant, like extermination. But before you get to that point in the progressive era in the United States, it could mean everything from just wanting babies to be born, have healthy babies born, all the way up to sterilization and euthanasia. And we know that there were physicians and other policymakers, who even advocated, for example, for euthanasia of disabled babies. And there's one in particular, I'm thinking of Henry Hazelden in Chicago, who actually carried this out. Syphilitic babies born under his care, he euthanized them. And I'm thinking about Marty Pernick's work from the University of Michigan on Hazelden and the black stork. And so, I think that attempting to make America healthy in the first place, not to bring in the MAHA logo there, but it was always done from a place of race and eugenic concerns from the very beginning. And so I think that we have to understand going forward into the 20th century just how much that shaped the entire public health apparatus of the United States. And it explains, I think, some of today's reticence about the federal government's involvement in healthcare, because so much of it was, unfortunately, often perpetuated from a racist standpoint. I'm thinking of the Tuskegee, trials, and Henrietta Lacks, and it shaped today how we try to regulate informed consent and medical testing. But again, that was because there were these egregious crises that happened that then changed regulation, and it was never done the problem was from the beginning. Those concerns shaped how public health was carried out in the United States, and that is a real problem that historians have tried to grapple with. And I know many historians of medicine have written a lot of different books about this, and so It's something that I think historians have looked at extensively, but the problem is that the general public today, only care, they might have heard bits and pieces and snippets, and then what that is doing is it kind of then erases or pushes down any of the positive public health gains that were made over the course of the 20th century, of which there were many. And so again, it creates the conditions for, why don't we just listen to the science? Like, look, the science, the data, it's showing all this is good. And then, but also on the other hand, there's distrust, and rightfully so. And those are two things that are very, very difficult to grapple with.
So if I can pick up there, I think the points you just made about trust and distrust relate very much to one of the challenges of federal agencies. So one of the most interesting parts of my job in my mind is the fact that I interact with and talk to people who are in kind of policy implementation spaces across a wide variety of executive branch agencies. And it's striking how challenging it is for federal regulators, but also science agencies to really understand variation across the US. And so if I had a time machine and could go back, I think I've been thinking about this. I think the lever I would want to push on is in the design and construction of the federal advisory committees. They're, of course, intended to provide a high degree of credibility to agency action, but also to work as a two-way street, so to communicate, back to their relevant communities. Now, of course, they've been built over time to be scientific and medical experts. And so the community is, cardiologists or some other professional community. What you haven't had is a way for agencies like FDA or others to really hear from and interface effectively with faith-based communities, geographically regional. It's very different to be a native tribe on a reservation or in a small rural community in the Upper Peninsula of Michigan than to be in suburban Maryland. And in that, to somehow find a way, and this one's super challenging, but find a way to weave kind of that qualitative experience of the patient with the disease and with the treatment into how you regulate. And, I don't pretend that's an easy thing to do.
I think for me, I would probably go back to 1962 to meet with the Kefauver-Harris architects. That reform following crisis allowed for more robust evidentiary standards in terms of efficacy. And the FDA and the regulatory system has, by and large, done a very good job in terms of nurturing safe and effective prescription drugs to market, but has done not quite as good a job in ensuring that those safe and effective drugs are affordable and accessible to as many Americans as possible. So if I were to go back, I would sort of encourage them to think about either comparative effectiveness mandates or pricing transparency measures that could better align innovation with clinical value and allow greater access to more affordable prescription drugs for more Americans.
It's a good thing we don't have a time machine, because you would be breaking and repairing the system left, right, and center here. These are very bold. My husband's a physician, and we often have these interesting discussions where he'll show me the latest article of something in JAMA, New England Journal, and I'm sure, Todd, you also have these conversations.
Indeed.
And, oh, you should see this. But like your spouse, my spouse is not trained as a historian, but he's lived with one now for a long time. And so we'll sometimes have conversations about something he's reading, and I will throw in a historical anchor, and it will shift a little bit how he's reading the study and what he's thinking about. And he's now doing some writing, and I keep on saying, well, but you need to think about the gender implications, the class implications, the policy implications, the things that we as historians think about automatically a lot, even if you're thinking about public policy, Arthur. Like, these are things that are part of what we were trained to do. And so this is a very presentist question, which I recognize is dangerous. But what do you wish that people today would know if any non-historians are listening to this podcast, what do you wish that people today would know about regulations or policy and how they've changed or not?
So I'll start and say we would not have the modern pharmaceutical industry if it weren't for the FDA. So one of the, it wasn't an accidental byproduct among some of the key reformers in the early 1900s. It was very much the intent. It was to shift what the medicine making of the time, which relied a lot on lots of alcohol and tinctures and heavily marketed, widely sold, very popular cures that, really, I mean, alcohol's effective at certain things, but it doesn't really treat that many diseases. In fact, it causes lots of them if you drink enough of it. So they really sought to get the industry to invest more in research and in producing, both in inventing new medicines and then in producing them in much safer ways. And the regulation had a profound impact on an industry that then found value in investing in research. That, of course, led to some of the crises that led to Kefauver doing his investigations around pricing, like why are you all charging the same amount for your antibiotics that you supposedly, found independently and competitively from each other, and then used the thalidomide crisis to quickly rewrite into health and safety, which, yeah, I think Todd's pointing to a very interesting question of could that have been less of a rewrite and kept some of the provisions it wanted? They were just trying to get an act through, which is often what happens. But yeah, thinking back, there was a real opportunity there. But in any case, I think we sometimes lose sight of the ways in which regulation and industry have a mutual shaping over time, not just in the negative connotation of capture, but in a positive sense as well.
I think to piggyback off of that, one thing that your comments just made me think about were, and to your original question, Gwen, which is what people who are not historians, who maybe don't necessarily know all of this history, one thing I think I want to emphasize is that we went from a place of utter deregulation in the 19th century, in that deregulation is not the right word. There just wasn't any. Well, and I'm misspeaking a little bit there, because of course there was there was pharmaceutical law in the states. Every state was responsible for passing its own version of pharmaceutical regulation. But the problem was there was no cohesiveness to that. And so what that ended up allowing for was all kinds of, or the proliferation of the patent medicine industry. And if you go back in history, you can see just how harmful that lack of regulation was in terms of the patent medicine industry, because so many people were poisoned by buying medicines, quote unquote, on the market, which were sold through from everything from the corner druggist to the Sears Roebuck catalog. You could just buy preparations that advertised to do everything from fix your migraines to your back pain, to also, of course, within my research, I look at abortifacients and early birth control that was sold on the market. And, even if we think about abortion laws that were passed in the early 19th century, like we're talking 1828, 1835, those even were aimed at first at that patent medicine market, because there were many women who were buying abortifacients, preparations from, the local druggist or whatever, and they were not regulated, and they had high levels of, all kinds of herbs and chemicals in them that might have produced an abortion, but also might have killed the woman taking it. So I think that one big picture piece to keep in mind is that we have been in a place in this country where every state made its own pharmaceutical law. They made their own poisoning statutes. And the reason that the 1906 Pure Food and Drug Act came about was in part because of the fact that the states were just not able to, in a country the size of the United States, there needed to be something else that could oversee and direct this kind of regulatory framework. Having all 50 states do it slightly different ways is not the answer. And I think that, unfortunately, that is the push that we're certainly seeing today.
I really appreciate that point. It also makes me think about how our earlier conversation about crisis-driven regulatory work has really informed much of what we have. And to Arthur's earlier point about Kefauver-Harris, that the process by which we've developed, or that the policymakers have developed the regulations in place, have often been the outcomes of messy compromises. And for people today to sort of to have a better appreciation of that, and not to sort of assume that sort of this regulation has been handed down from on high. It's more complicated, it's more messy, and that's why we see continuous reform efforts to remake or scrap or improve upon our existing regulations.
So just a quick point that builds on both of the last two comments. It strikes me that there's this vision or ambition or hope that we could enter an information-based regulatory era where you wouldn't need as much testing or as much agency oversight because you could widely share individual consumer experiences or just get so much more information off the internet, so you'd know, like, oh, if this thing's harmful, someone's reported it, so then I won't buy it. So, what do you need all this government for? And we're seeing the MAHA movement is at times a deeply anti-regulatory, in other ways very pro-regulatory, right? They want a different kind of food product. They want dyes and synthetics removed. But one of the risks of deregulation is that in the medicine space, and this takes us back to Lauren's point about the late 19th century, medicines are very cheap to manufacture. They're cheap to ship, they're small, and they're really easy to sell. And so it's an area rife with just fake products to this very day.
I'm thinking about the signs that occasionally pop up asking if you have extra Ozempic or Wegovy, like a year ago, trying to buy them. And I thought, who would buy from an unknown purveyor on the street? But you all look honest, so perhaps I would buy them from you.
People do it. Yep.
Clearly, people do. So I have one last question, I guess, which would be if you have any parting thoughts that you would like to share about the progressive era, reform, drug regulation, policy, any of the things that we've been talking about that you've been thinking about that you'd like to make sure that gets out there.
So I have a quick one that builds off an anecdote. So FDR famously, started his career in New York City and was not a big, large government person early in his career. And there was this act proposed to control and regulate the way people were making cigars and cigarettes in tenement houses. And he was opposed to it. And one of the advocates in this early progressive era said, why don't you come with me and see one? And so he goes and visits it and realizes, this is a room with like 6 family members living in it who are also getting all this tobacco loaded in that then they have to roll up. And then they're also leasing out space to someone because they're that poor. And he sees both how unsafe the conditions are, how easily this will lead to, a fire and huge loss, but also just the conditions. And so I would say one legacy of the progressive era we ought to get more of is for politicians of all stripes to go out and actually see what people's lives are like to better understand their role in helping make them better.
I think my parting thought about is going back to MAHA and the slogan, Make America Healthy Again. I have a lot of questions about that slogan because obviously all 4 of us here, our research illustrates like just what the mistakes were in the past and how there have been strides made, but we also complicate and make complex with nuance those strides, right? And so I'm not really sure what the current administration's goal is with that slogan, because I think that there seems to be a kind of romanticization of the past, because I think that those who buy into MAHA and that slogan I sort of thinking about, like, maybe in the past, like, everyone was healthy because there was no chemicals and there was no, modern industrial pharmaceutical behemoth industry kind of thing. But like, that's just not true. It's just not historically true at all. And I am very intrigued / concerned about the direct connection that the administration seems to want to make between health and history, and telling a false narrative about what health used to be like. And therefore, we must do these things to return us to some mythical past. And there seems to be a real tendency to want to rewrite the past to fit some future goal. And I think it's really important that historians and all Americans, continue to emphasize, hey, here's the actual series of events that took place in the past. And, the progressives were very forward looking. And I think that one of the things they saw was that the past was bad in terms of health, and therefore we want to try to fix that, the future, the current, the present and the future, by not repeating what we did in the past. And I think maybe that's the disconnect there, is that this administration and the current, Robert Kennedy seems to want to not look at the past, not use the past in the right way, I guess. So that's my parting thought about that. There's a real disconnect there between the progressives and the way I think the MAHA people envision themselves as the new progressives. And I think that they don't have the right to compare themselves to the actual progressives because of what they're doing currently.
I would only add that I would advocate for a return to the progressive push for transparency. The progressive push for truthful labels holds true today, but is even more critically important in our dis and misinformation age, and questions of trust or lack thereof in the government and in health agencies, who are going to be tasked and pressured to find new ways to address health misinformation.
Thank you. It drives me crazy when students say back in the day things were so much better, because as historians, what decade, what era? There were problems today, but who was it better for then? So I guess, yes, for progressives and moving forward, as you pointed out, Lauren, there are definitely points when we were striving for some reform that we didn't necessarily get. I would like to thank all of you for participating in this panel on progressive reform, federal regulations, progressive reform, and beyond. And thank you for AHM for sponsoring this as well.
This has been a podcast from the Consortium for History of Science, Technology, and Medicine. For more information on this topic, as well as other podcasts, working groups, fellowships, and resources for learning, research, and teaching, please visit www.chstm.org.